Most hip pain does not need an MRI, but some symptoms are red flags, and waiting can cause permanent damage. Many hip pain cases are caused by muscle strain, arthritis, or overuse. They usually improve with rest, physiotherapy, and simple medications. If you have severe hip pain after a fall or injury, especially if walking is difficult, an MRI is urgent. An MRI looks for hidden fractures, labral tears, or muscle and tendon ruptures. If you cannot put weight on your leg and the pain feels deep in the hip or groin, this is serious. This could mean a hip fracture, a stress fracture, or severe joint damage. Pain that wakes you up at night or hurts even when lying still is a major warning sign. This can indicate serious issues like bone infection, a tumor, or avascular necrosis. Pain deep in the groin with clicking, locking, or catching suggests internal joint damage. MRI can detect labral tears or femoroacetabular impingement, also known as FA. Hip pain with fever, redness, or feeling sick is a medical emergency. An MRI helps diagnose septic arthritis or serious joint infections. People on long-term steroids or heavy alcohol use are at high risk for bone death. Identifying these issues early with an MRI can actually save the hip joint. If you have a history of cancer and develop new hip pain, do not ignore it. The MRI is used to check for bone metastasis or pathologic fractures. If hip pain lasts more than 4 to 6 weeks despite rest, medicines, and therapy, MRI is needed. It helps identify deeper damage or bone problems that X-rays might miss. MRI is usually not needed for mild pain that improves with rest and normal walking. The first steps are usually a physical exam, an X-ray, and conservative treatment. MRI is not for routine hip pain. It is for red flags, persistent pain, or serious suspicion. If pain is severe, worsening, or limiting daily life, don't ignore it. Remember, an early diagnosis can save your joints. Stay informed and take care.